Okay, welcome everyone. Welcome to our fireside chat, Caregiver Essentials, how to successfully advocate for yourself and those that you love. My name is Jenny Woodworth. I am so glad to be here with you tonight. Advocacy is really important to us. In fact, it's one of our themes for our curriculum. It's a passion for me in both micro and macro settings, and definitely something our agency is interested in as a whole. So I'm glad you all are interested in it too, and I'm glad we have Beth with us tonight to talk about that. Just a little bit of housekeeping. We are recording this program, but of course, we are the ones being spotlighted, Beth and I. We may not have time for live questions. I'm thinking we will though, but and those will be in the chat. Those of you that are watching this, unfortunately, probably won't have access to those. There will be some follow-up information. Beth has some worksheets that she'll share. I will share via an email tomorrow. And I just want to take a minute since you're here. Again, I recognize a lot of you, which is great, but I want to take a minute just to tell you a little bit about Courage to Caregivers and what we do to support family and professional caregivers. So we are a nonprofit located in Northeast Ohio with an old mission now. I have to update this, but the mission when we did this last time is to provide hope, support, and courage to caregivers and loved ones of those living with mental illness. Now we're equipping caregivers on their journey. Similar missions, we're trying to do all of those things. We are now serving caregivers nationwide. And again, some of you are joining us from across the nation, and I love it. So we focus exclusively on the caregiver and see ourselves in the caregiver burnout prevention business. We're offering three programs, currently at no cost to participant. We're doing all this virtually, just like we are tonight. So one-to-one caregiver peer support and certified family peer support matches caregivers in need with trained volunteers or employees who have that experience caring for someone living with mental illness. They get it. We also have weekly support groups that are co-facilitated by someone with a certification. So a certification in prevention, social work, or a certified family peer supporter. So our support group slash coaching model, we provide essential tools to build a caregiver's resilience and just really help them support themselves while they're supporting others. So again, this isn't therapy or counseling, more like coaching sessions. We also have breathing meditation. We have moved that exclusively to YouTube, but it still has sessions that tie into our curriculum and themes. So we provide breathing techniques, light yoga movement, guided meditation, all that good stuff. And again, that is available on our YouTube channel where this recording will live as well. So, with that said and done, I'd like to introduce Beth, our panelist for this evening. She and I will be in discussion about healthcare advocacy. So, Beth has worked in healthcare administration her entire career. Most recently, she served as president and COO of Rosman Search, a highly specialized physician staffing firm. Previously, Beth was a director of hospital contracting for Anthem Blue Cross and Blue Shield, Cleveland Clinic, and Kaiser Permanente. With decades of experience across health systems, insurers, and physician practices, Beth understands the healthcare landscape from every angle. She brings that insider perspective directly to patients and families, translating complex medical and administrative processes into clear, actionable steps. And who doesn't need those? So thanks, Beth. Welcome. I'd love to start this session by thanking you for spending this time with me and also kind of asking like why? Why is healthcare advocacy important to you? What brought you to this? What drew you to this?
Oh, thanks, Jenny. I'm so thrilled to be here with all of you. So thank you for having me. So as you said in my bio, I have been in healthcare administration my whole career, and over the last several years have watched things really change. Used to be things were simpler. You had a primary care doctor who'd been your doctor for a long time, knew you, knew your health issues, probably knew your family. Had the time to really get to know you and your issues. That is no longer the case. As the healthcare system has become more and more complex, doctors simply don't have the time to do that anymore. And that burden is now on the patients and their family and their caregivers. Like all of you, I know I'm not telling you anything you don't already know. But as that has changed, we now have to be our own technical experts to manage electronic medical records with in some ways, it's not bad for those of us introverts who don't want to have to talk to someone. We can make our appointment through my chart here in Cleveland. Great. But there are definitely times when it doesn't work so well. So you have to know how to troubleshoot, have to understand the electronic medical record, and you have to be the keeper of
Mm,
your own health data. No longer can you show up to an appointment and just think that they know everything. Because if they even had 5 minutes to review your information before they stepped into the room, you're doing well. But a lot of times they don't even have that. So you have to be responsible for knowing your health history. You have to keep your medication list up to date. They're going to ask you about it, but you have to be the one to be prepared to show up with that. So
mhm,
lots of changes in healthcare. This is just kind of the tip of the iceberg. We'll get into some of the others. But as I saw that going on, and I saw among people I knew and friends and people older, they were really struggling. And so last year I was looking to make a transition, and I
mm.
couldn't imagine anything more meaningful or more necessary than working one-on-one with people who are really struggling to navigate the system. So that's what I decided to do. It is incredibly rewarding, really love it, and very excited to continue to help people.
Great. I'm glad you're out there. Was there a particular experience when you look back that shaped the way you think about advocacy, how you show up every day in this field?
Absolutely, great question. There are several. I'm going to start with a personal story.
Great.
So, about 8 years ago, I had a new primary care doctor, and she's looking over my results and lab results and blood work. And she said to me, "Has anyone ever talked to you about your thyroid?" And I said, "No, why?" And she said, "Your numbers are really not good." And she said, "I'm just surprised that you're not exhausted all the time and freezing cold." And I said, "Oh, isn't everybody?" And she said, "No, not like this." She said,
Mhm.
"Are you open to thyroid medicine?" And I said, "Absolutely." And that has made such a tremendous difference in my life. And it really kind of, the light bulb went off. And I thought, wow, I grew up in a household where don't complain, just get on with things, and certainly don't bother people in authority, in
Mhm.
positions of authority. And so I never said anything, and I should have. And so, one of the things that I bring to this is absolutely the importance of speaking up and sharing what is going on with you, and don't hold things back. The other examples I want to give are with people that I've worked with. The first is a story about Helen, not her real name. Um, and Helen, 80, very independent, does not like to talk about her health, has two children, doesn't share what's going on with her health wise. Kind of, if you need, I'll tell you if you need to know something, keeps
Mhm.
it very private. Went to the cardiologist. He gave her a new medication, said take it after dinner. She started taking it, and she started getting very dizzy when she took it. And she figured, oh, well, this is what he wants me to do. It'll be fine. I'm sure I'll get used to it. And she kept taking it. And one night after dinner, got up and promptly fell, broke her hip, ended up in the hospital, rehab, no longer able to live on her own, really unhappy about it. I
Mhm.
contrast that with someone else I know, Bob, also not his real name, who has also two children, about 80, and is very close to his daughter, who he really views as his healthcare advocate and partner in everything healthcare. She was over for dinner one night. She noticed after dinner he didn't seem quite right. She said, "Dad, what's going on?" He said, "Oh, it's this new medication. It makes me dizzy." And she said to him, "That's not okay. I'm going to message the doctor." "Oh, you don't have to. I'm sure it'll be fine." "No, no, I'm going to message the doctor." She messages the doctor. He gets back to her the next day. He said, "Oh, I'm so glad you told me. Have your dad start taking it before dinner away from his other medications. We don't want him to be dizzy. If that doesn't work, let me know so we can try something else because he should not be dizzy." Switches it to before dinner, problem solved, no more issue. And so, but these are the kind of situations that people are facing. And it really points to why it's so important that you either have someone that you feel comfortable sharing that information. For the people on this call, you're the beneficiaries of that information. And why it's so important that you advocate for yourself and the people that you take care of, just critically important. And so all of that kind of highlighted for me, this is really needed and important.
Yeah, definitely. Those stories definitely help bring this to life. I'm sure people on this call have their own stories. But why don't we rewind just a little bit? I think why don't we all come at this with the same definition? How do you define healthcare advocacy? What's the lens you bring to your work?
Absolutely. And I'm going to start with the dictionary definition, um, which is the practice of supporting someone to make their voice heard,
Mm,
is across all disciplines of advocacy, political, really all types of advocacy, really supporting someone so that they get to be heard. Healthcare advocacy is actually a relatively new field,
mm,
even though people have been advocating for other people and themselves for a long time. But in terms of a actual formal discipline, it's really relatively new. And it's somewhat of an umbrella term. I know advocates who are approaching it from a health equity perspective. Do people have access to quality, affordable care? They're
mm,
working very much in that arena. And then there are people like myself who really want to support people one-on-one to make sure that, not from a clinical sense, but from a support sense, that they understand their options and are able to really have their voice heard so they know
mhm.
how to do something and get options and answers.
Okay, great. That's a great way of looking at this. And we've touched on this a little bit, but if there's anything else you want to add, I mean, why? Why do we need to do this? And again, it may seem pretty obvious, but I'm sure you've got numbers and ideas, especially coming again as this in this advocacy role. Like, why do we need healthcare advocates? Why do we need to advocate for ourselves within this system?
Sure. We're actually at what I think of as kind of a perfect storm right now in healthcare. There are a lot of things that are coming together and not in a great way. Um, the first is that there is a shortage of physicians like we have never seen before in this country.
Mhm.
By the latest data, we have a shortage of 50,000 primary care doctors in the country and 40,000 specialists. And that number is just increasing every day. The
Mm.
number of retirements is far outpacing the number of doctors who are finishing their training. So we're seeing things like in Missouri, where you can now practice medicine without having done a residency. They are
Wow.
so desperate for doctors that they're taking doctors without a residency. And that's very frightening to me. But that's the kind of shortage we're in. So, given the shortage, everybody knows who's been to the doctor somewhat recently, the doctors are being asked to do more with less. So, the average time that they have to spend with a patient is 13 to 20 minutes. So, if you've
Mm.
got 15 minutes with your doctor, it is not enough. So we're going to talk about some strategies for how you handle that. But that is one of the biggest pressures facing healthcare today, is just the acute shortage. And so they're trying to fill in with nurse practitioners and physician assistants
Mm. Mm.
and medical assistants, which in some ways has a place, but it could never replace a doctor. So that is putting just tremendous pressure on the system. And a system under pressure makes mistakes.
Mhm.
And unfortunately, I wish I had a magic wand and said, "You've all come to this talk. No mistakes will happen to you or the people you love." But that's not the case. But what I
Mhm.
can do is help educate and inform so that you are aware of what's going on, so that you can pay attention and know where the stress points are and where to look. So their latest data for last year shows 1.5 million medication errors alone in this country.
Mm.
That could be anywhere from the wrong prescription to the wrong dose to a bad medical interaction. I have a friend who's an ER doctor. She thinks that number is way understated. She actually thinks it's a lot higher than that. So something to be very aware of when you get a prescription is to make sure, is this the right thing? And that's
Mhm.
where leaning on other parts of the system, like the pharmacist, to say, here's my list of everything else I'm on, anything that concerns you. You know, the pharmacist usually, when you pick up a prescription, says, any question, or the person checking you out, any questions for the pharmacist? That's a perfect opportunity.
Yeah.
Um, 10% of the people who are admitted to the hospital will experience some type of medical error. It's
Mm.
just, again, a stress system makes mistakes. Not because anybody wants to. I really
Yeah.
believe that people go into healthcare because they have a true desire to make people better, but things happen.
Yeah, things happen. And we've said a few times a stress system makes mistakes, and that's where we're coming from. We're all feeling that stress in general. So the systems we interface with, it's no different. And I don't want to dwell for long on medical errors and mistakes. And you've touched on some, but you've probably seen them in your work and your daily life. Tell me just a little bit more about, things that we should keep an eye on, the things you've seen in your experiences.
Absolutely. So medical mistakes, as I said, that's the most common. Surgical mistakes happen all the time. Exactly.
Mhm.
There's a very well-known famous case where someone went in, one diseased cancerous kidney, one fine kidney. They took out the wrong one. And you'd think that how could that happen? But it does. It
Mhm.
happens with all sorts of things. You'll see nurses take marker and actually write on themselves, this is the one in with arrows. And that should not have to happen, but it does. And again, because there's so much pressure to turn those operating rooms so fast, the checks and balances that used to be there because they had a few extra minutes to double, triple check.
Mhm.
And sometimes they do, again, but not always. And so you want to make sure everybody who's going to touch you or your loved one knows exactly what they're doing, which whatever they're removing, where they're looking, whatever is happening, that they have the right patient and the right surgery, and that's what's going to happen. And then there are mistakes that happen, again, because everybody's so busy. Very sad story here locally. A woman in the hospital, fall risk, had the bars up at the bed. The nurse was helping her back into bed after she'd walked around a little, got paged, ran out of the room very quickly, forgot to put the bar up.
Mhm.
The woman, exactly, got up out of bed at night, fell, hit her head, never recovered. So just these are things that we unfortunately are living with in this system, and we have to be aware of it so we can protect people.
Yeah. Well, and let's move to that. What are some steps that people can take to advocate for themselves and their loved ones? I want to talk about the problem, but what I really want to focus on, and I know you do too, is what do we do with these problems? How do we approach this in a proactive way? So tell me more.
Thank you. Yes, exactly. I don't want to just come with problems. I want to come with some
100%. Yep.
solutions.
Hmm.
And so I've broken it down into a way that I hope people will remember. And again, as Jenny mentioned, you'll get handouts tomorrow. And so don't feel like you have to take notes. This will be recapped in a hand. I have two handouts, one that recaps and one that gives you a template for how to prepare for a doctor's visit.
Great.
But the first thing is observe. No one will ever know what you're going through better than you. A caregiver is a great second best. So you want to observe yourself and you want to observe the people you're caring for, and really think about, oh, gee, my knee hurts when I do this. Um,
Mhm.
this medication makes me feel a certain way. I don't like that. Or, yeah, I actually feel better. So observation is critically important. It's not enough, however, just to observe it because we are human and we have a lot going on. You want to write it down. And I actually did not grab, but I have a very fancy medical notebook that I got on Etsy that's, I know, very
Mhm.
cool and all divided. And for people who like that kind of thing, I'm happy to send you the link. And that's great if you are one of those kind of people who like that. But truthfully, a plain notebook from the drugstore works just as well. Everyone in your household should have their own healthcare notebook where they're writing things down about how they feel and what's changed and what's different. Very important so that you can look at what is changing over time, what is the pattern, and what do you want to be able to share with the doctor. So observing, writing it down. The other thing I find when I write it down, if I haven't written it down, it kind of stays in my mind and I keep playing it over and over again. Once I write it down, I can move on. So writing it down is really important, particularly in a place where you know you're going to be able to access it again. So don't put it on a little post-it and then lose it. Have a dedicated place where you write your health information for yourself and the people that you're taking care of. Really important. So observe, write it down, and then the most important thing you can do before you use that average 15 minutes of time with a doctor is be prepared. I listened to a primary care doctor a few months ago talk about what she needs in her practice. And one of the things she needs from her patients is to not go into more than three questions. At first, I was really taken aback. I'm like, three questions? I could never cover everything in three questions. But when I took a step back and I started to think about it, I thought, you know what? Most of my issues kind of group into three buckets. It's not usually more than that. And so I thought about if I'm prepared and organized, I can do that. The other thing she said was bring up your concerns and questions at the beginning of the appointment. Don't wait until the end when she's got one step out the door and already thinking about her next patient, and call her back. She wants it up front so that she makes sure that she is addressing your concerns. And I thought that was really good advice as well. So preparing for your doctor visit. You don't want to sit there and think about, wait, what dose am I taking of this medicine? What supplement have I added? You really want to make sure that you're prepared. And that is one of the great things on my chart and probably most other electronic medical records as well. Your medication list is listed right there.
Mm.
So what I advise people to do is print it out, handwrite any changes, anything that's been added if you have a doctor who's not connected to the electronic medical record and they prescribe something. If you're not taking something, if they prescribed a dose that was too strong and it's now been adjusted, again, if you handwrite, then the assistant will be able to update the information. And it's so important that that is correct because that's what the doctor, if you end up in the emergency room, is going to depend on. So really important that you're prepared, that you know what you want to ask, you have an update on your any conditions that are ongoing, and your medication list is correct. So observe, write it down, and be prepared. Very important. The next thing that I really think is so important in all of this um, came out of a book I read that, again, will be on the list that I really recommend by Jerome Grootman, a doctor out of Harvard, who wrote a great book called How Doctors Think. And it is really helpful to get in their head. And, he said doctors are human. They like people who like them. They want to do a good job, but they depend on you to be honest and to tell them what's going on. And if you're not feeling like you can communicate or not feeling like you're connecting, we've all had those relationships where, whatever reason, we're just not connecting. Then it really is not a great relationship. I met a gentleman who said to me, "Oh, I had a great doctor. He retired, but he was the best. I had him for years. Then they assigned me to this young gal in the practice. She's nice, but there's no way I could ever tell her about what's going on with my stomach." I'm like, then she's not the right doctor for you. Either
Mm-hmm.
find someone else in that practice, find another doctor, but you have that relationship, particularly with your primary care doctor, is so critically important that it's worth, maybe not in the moment, you can kind of figure out how can you address it, but think about how can you make a change. And I know when everybody has so much on their plate, the last thing they want to think about is finding another doctor, but it's worth it. The communication and connection, critically important.
Yeah. Well, and as you've mentioned, doctors are human under stress, working within a stressful system. Tell me more about why you should possibly seek a second opinion when you're dealing with such challenging medical conditions.
I am so glad you asked. I don't think second opinions get talked about nearly enough, and they are really, really important. So there are a couple reasons why it would be important to seek a second opinion. If you're not sure that your medical team is really on the right track with whatever you're dealing with, that's a great reason to get more data. They might be, you're probably going through this for the first time. And so hearing from someone else of, oh yeah, that's exactly what I would do, that's very reassuring. If you have a diagnosis that's rare, a rare type of cancer, something that your local hospital or doctor probably hasn't seen in a long time, if ever, that's a great reason to find a team that deals with that all the time. Because in medicine, it is definitely, there is an art to it and there's a science. And you
Mm,
want someone who's done it a lot. You don't want someone who's figuring it out on you. So if there's something rare, that's a great reason for a second opinion. If there are limited treatment options, and so your doctor is steering you toward one, that might be because that's what he or she is comfortable with.
wow.
Again, more data can only help make a better decision. So really important. And I know people are hesitant. Oh, my doctor is going to think I don't have confidence in him or her, or that they might not like me then. A good doctor wants you to have the best treatment. Truly, they do. And second opinions can save people's lives. Really important. Mayo Clinic does a tremendous amount of second opinions, maybe the most in the country. They did a study on the last 12 months of second opinions they gave. 90% of the second opinions they gave resulted in either a completely different diagnosis or a more refined diagnosis. And in
Wow.
healthcare now, it's all about the specialization. So the more refined they can tell you about your type of cancer or what's going on with you, the better they can treat it. And 91% of the people who sought a second opinion at Mayo Clinic were very glad they did. So I know it's tough and how do I bring it up? But it's worth it. And I'll share a quick story about someone I know loved her oncologist here in Cleveland, thought he was the greatest, thrilled that she got to him, very glad. The problem was after 6 months, nothing was happening. She was still in the same stage of cancer she was in. The tumor had not shrunk, nothing had changed. She was feeling terrible. She sees her oncologist. She said to him, "What would you think about getting a second opinion?" He said, "I think that's a great idea." She went to Memorial Sloan Kettering, one of the top cancer centers in the country. It's in New York. Saw a great oncologist there who was not looking to suddenly become her primary oncologist. He absolutely was in good communication with her oncologist in Cleveland. They shared the results. They talked. He said to her, "The plan is good." He said, "I would just make a few tweaks." And so the two doctors talked again, made the tweaks to the plan. She's now in remission.
Wow.
Exactly.
Incredible.
And she's still getting care here in Cleveland. She's still getting care with that original oncologist, but she has someone else on the team. So they can bounce things off of someone else. Just a real reason why it's so important to consider a second opinion.
Yeah, that's incredible. Thanks for sharing that story. Yeah, I'm so glad for your friend.
Oh, thank you.
Yeah, so we talked a little bit previously about, what can you do? Observing, preparing, communicating, connecting. What else can you offer to our people tonight? Other ideas for caregivers while they are advocating for themselves and their loved ones?
Absolutely. So the next thing after you've connected and you've had your appointment is really being vigilant.
Mm,
There are pros and cons of the AI note taker that are being used in most
mm.
medical offices these days. I like it that my doctor isn't staring at the computer and typing at the keyboard, can
Me
actually make
too.
eye
Yeah.
contact, call me crazy.
Mhm.
Um, but just like a human makes mistakes, the AI note taker makes mistakes. And so, very important that, again, back to the you have to take responsibility, even though the doctor reads over the notes before they're finalized and signs them, there are mistakes like you wouldn't believe.
Mhm.
Friend of mine had a double mastectomy, went for a follow up. The nurse says to her, "Oh, I see we removed your right breast." She said, "No, you removed both." She said, "Oh, well, that's not what it says here."
Oof.
They laughed about it and she
Yeah.
corrected it. But had my friend ended up in the emergency room, that could have been a very different scenario and very scary. So it is unfortunately again on you or as the caregiver for for yourself and the person that you're caring for. You have to look at that. You have to read through not only the after visit summary, but one of the more transparent things, and again, one of the benefits of the electronic medical record is all of the visit notes are up there.
Mm.
So you need to read them and you need to make sure that they are correct. Another funny story, a woman was chatting with her doctor and the AI note taker was in the background and he said to her something about how's your grandkid? And oh, and my daughter's pregnant again. So the AI note taker, 80-year-old woman pregnant. I mean, again, we can laugh, but important that it get corrected. I think the ER would have known that was a mistake, but still, you want it to be right. You want it to be correct, and not leave those kind of things hanging out there. So definitely being vigilant, and being clear about who is doing the follow-up. So if your physician says, "I want you to see this specialist," great. Are you making that appointment? Am I making the appointment? Who am I making it with? What happens if I can't get in for 8 months? Is that okay? Or at what point do I call you back and say, help? And if I have to call you back, do I ask for someone specific in your office? Because if I just call the main number, I'm going to be on hold and go through all sorts of rigmarole. So how do I do this? Who's doing what? If there's a change in prescription, are they handing you a piece of paper? Are they calling it in? So again, really being clear. And that's where you as the caregivers are with someone to make sure that that happens. One of the things we know from research is that when it's personal and important, we retain less than 20% of what we hear. So this is where if you can't be with someone, find someone else to go with oh, there's your cat. If you can't go with your person, or you don't have someone to go with you, find someone else, hire a professional advocate like myself. But it's really important that there be another set of ears and eyes. So being vigilant, understanding what the follow-ups are and who's doing what, really important.
Appreciate that. Sorry, my cat wanted to be YouTube
Don't be
famous for a
sorry.
second, but I put him down. I was just telling you, he never comes up, and now he's doing his thing. Since we have you as an insider, this is a kind of an interesting question. What are some things patients often don't realize they have the right to ask for? Tell us the secrets, Beth. Just kidding. So, what are some things you could offer on that question?
Absolutely. So one of the secrets, and I share this widely, but and this gets back to the communicating and connecting. When you have the right kind of relationship with your doctor, they are often willing to share their cell phone. Um, you know, you shouldn't need it in this day and age, but unfortunately, it's hard to reach your doctor sometimes. And you can my chart message them, and it takes their first of all, they might not be the one to see it, or it could take a while for a response. So, asking, what do I do in an emergency? Someone I was working with, she was on a new medication. It had very serious side effects. She tried to call the doctor, couldn't get through, couldn't even find someone to take a message. Got a very weird answer of, oh, we only take messages on Tuesdays and Thursdays. Like, excuse me? Exactly. But so I said to her, the next time you see that doctor, you want to say what that she ended up calling an ambulance and ending up in the emergency room, which she did not need. And had the doctor been available, she would have told her what to do. And so ended up in a busy emergency room with sick people with infectious disease. That was not what she was a good outcome for her. So she said, how do I, what do I do next time if something ever happens? And the doctor gave her cell phone. So that's one of the things that I think is really important of how do I reach you? And I promise, and you don't abuse it. That would ruin my tip. But, it's really important to make sure that you do have a way if you're experiencing something that's serious to reach someone on the care team. Very important. This is one of my stepmother's tips. She's an amazing baker. And whenever she goes to see a new doctor, you better believe she shows up with muffins or cookies or something. And again, back to Dr. Grootman's, comment of doctors are humans too. Who doesn't like baked goods? So when you're trying to build that relationship and, and foster that, whatever it's going to take to so that you are taken care of and your loved one, it makes a difference. If they only have 10 minutes to return phone calls at the end of the day, you want yours to go to the top of the list.
Got it. Thank you.
Sure.
I'm going to ask people if you have any questions. Now's about the time to start putting them in the chat. We may be able to answer them online if we put them in the chat, so that would be perfect. So as we're kind of wrapping up our fireside chat section, you and I, What, if you could leave this group with any one message about advocating for themselves and or their loved ones, what would that be? Besides
Sure.
muffins. Yeah.
Besides Muppets, it would be communicate
Yeah.
that these are such important relationships that you have to be able to communicate and then you have to do it. You could have a great relationship, but if you keep things to yourself, it's not going to do anybody any good. So be prepared, be ready to communicate in the limited time that you have to make sure that you are making that connection and the doctor understands what the issue is, what's changed, why this is important. So I cannot stress enough how important that communication is. Really, just very important.
Thank you. And I will say, feel free to chat me directly. There's no main chat available this evening. Just you can look up my little name, or you could chat Christy Horner. Um, oh, so anything else before we move to questions? I've had two come up personally, so I can ask you those here in a minute. But anything else you'd like to add before we move to questions?
No, the only thing I'd say is that I am in awe of the people on this call. What
Mm.
you are doing is just unbelievable, and you are heroes. And so, thank you for doing that. It is not easy. You add in everything else you have going on, and sometimes I think it's harder to be an advocate for someone you love who can also be a challenge. And so, what you are really heroes. And so, thank you.
Here, here. I concur for sure. So I've had two questions. Well, one, I should be clear. I am asking this because I think a lot of folks on this call are supporting people over 18. How does, when we deal with privacy laws, which I'm glad they're there, but they are just can be a barrier at times when you are trying to advocate for someone in your world. What kind of advice would you have for people that are dealing with privacy laws and trying to get the best care for the person they're supporting?
So there are forms that the person can sign. I always recommend that you have the forms signed so that everybody you're dealing with, and you can upload those in my chart too. So you
Yeah.
want to have access to the person you're caring for or your 18-year-old. What I said to my daughter when she was going to college is if you don't sign these forms and something, God forbid, should happen to you, I, they're not going to talk to me.
Mhm.
And so she signed the form. But now with a little, but mom, there might be something I don't want you to know. I'm like, uh-huh, sign the form. So very important that the privacy forms are signed before there's a need for them.
Got
Um,
it.
so there, and then if someone is inpatient, there might be a form that the hospital might want you to sign so that they might have their own. So really important to ask. Probably not in the middle of crisis, but once if someone is admitted, they're happy to give you the form. They want someone to also be there with them typically. So the hospital is very happy to share that. And you want to make sure that you have all the right forms in place again before you need them. Great question.
Got it. Yeah.
And if
Someone
someone isn't sure where to find the forms or whatever, message me. My contact information is on the handouts. Happy to send them.
great. Thank you. Someone concurs with you that HIPAA release forms have saved them so much trouble.
Yes.
So I've had a couple other questions. I want to make sure I'm going to kind of group them together to make sure that at least makes sense in my brain. How do you make sure that the caregiver voice is heard during appointments? Some providers aren't used to talking to caregivers as well. This is something, we are always advocating for the role of the caregiver on the care team, and some providers are having some hard time catching up with that. So, Beth, any words of wisdom on that question?
Absolutely. So that really used to be the case, 5 years ago, and particularly for a professional advocate, it was really like the doctor was like, "What? Who are you? What are you doing here?" Now I'm finding much more acceptance among doctors, but yes, particularly for a family member, they are very should be very comfortable with you being in the room. And if I do meet with resistance, what I explain is I am here to be the help communicate because
Mhm.
sometimes if my loved one doesn't understand or doesn't hear, I want to make sure that the medication is taken correctly, that he or she is compliant with what you want them to do. So we don't want to have to bother you constantly if she isn't understanding or there's a question. That's what I'm here for, is to make sure that everything is explained clearly so that when we leave here, she is compliant and doing what you want her to do and following the plan. And that usually makes sense to people because they don't want to get those phone calls to the office and those my chart messages. So typically when I explain it of my role and what I'm there to do, usually that, and as for me as the professional, have to have the form signed out, filled out, and they're very happy to engage.
Great. Thank you. And if
Sure.
anyone has any follow-ups to some of these, feel free. I'm trying to do my best to make sure I catch everybody. So, but I am, again, only human. So if I miss you, feel free to hit me up again. What do you do, Beth, if you are the caretaker of someone who is not mentally disabled, but is not able to be an advocate for themselves for whatever reason and refuses to sign a release? And this person said the doctors are not aware of her reality. Any advice for this person?
Sure. So if you are a family member, then I'm hoping that she will let you go with her to the doctor. If she won't let you go with her to the doctor, it becomes even more challenging. But typically, even without a release for a family member, if the patient is happy to have you in the room, the doctors understand that and will speak with you, usually in his or her presence, not they won't always call you. Sometimes they will. Just kind of depends on what they think of the patient's mental state as well.
Mhm.
But again, explaining it to your loved one of, I'm here for you. I'm not here to push you in any one direction. I'm not here to be your financial power of attorney or whatever. I'm not taking your money or putting you in a home. I really just want to help you with your day-to-day health care and make sure that we're keeping you as healthy as we can so that whatever you want is what is carried out.
Great,
And
thank
if
you.
there is someone in the family, what I've found is sometimes family dynamics, there's usually one person that someone really listens to, and that person might not be the one who can go to the doctor because they're out of state or they're busy, but getting that person to explain it as well can often really help.
Okay, thank you. I had someone, now many of the folks that, we work with here at Courage to Caregivers are supporting someone with mental illness. And a lot of your examples today have been about physical illness. Totally fine. I did have someone ask, what do you see as the nuance between supporting someone as an advocate that is suffering from more mental illnesses than physical illness? Any nuances that you've seen in your work?
So definitely, it adds a layer of complexity. I'm not going to lie.
Yeah.
As everybody on this call, I'm sure knows, when you're dealing with a mental illness, because you don't always believe you're sick. And so it's really hard to want to seek treatment if you don't believe you're sick.
Mm-hmm.
So that's where mental health support groups can really help kind of the person process of, oh yes, I do need this. Because again, the barrier is you want them to want your help. It's hard to push help on someone who doesn't want it. So if you can get them to see the benefit, they're going to be much more likely to work with you. And to again say, I'm here to help you. I might have an opinion on do I think you need this medication, but I want to work with you. If you don't think you need it, let's talk about what that reality looks like. Let's talk about how that plays out in your day-to-day life and see if that allows you to accomplish your goals and engage that person in a conversation. I'm presuming this is an adult, not a child, because everything changes when it's a child. But for an adult, of what are your goals? What's important to you? How can we get you there? And sometimes, again, with the family dynamics, it really becomes challenging. Sometimes it's nice to have a neutral third party to facilitate some of those discussions or someone else who isn't as close to it in the family.
Mm-hmm.
But yeah, it can become very challenging.
Yeah, that's all part of gathering a support network. So yeah, thank you for that.
Exactly right.
This is an easy question maybe for you. Where is the Mayo Clinic?
Oh, the Mayo Clinic is in Rochester, Minnesota,
Chester,
due
Minnesota.
north.
Okay, good to know. Thank you. A
Sure.
couple other questions here. Do you need to take a little break and get some water or anything? Or are you okay?
No, I'm
Okay,
good.
excellent. Can you ask for a paper copy of the lab work that you will need in 6 months versus them saying, oh, it'll just be in the system? My chart, and I hear you, can get confusing. Any insight on that?
Absolutely, you can.
Okay.
And you want to ask for it before you leave the office, truthfully. That's when they're most accommodating and they
Ah,
can easily
yeah.
print it for you. But if that doesn't happen, yes, you can send a message and say, please upload the copy of the lab, notes, and so you can print it yourself at home. Yes, if you want to go to an outside lab, that is absolutely your right. And again, my recommendation is to ask for that before you leave the office. It will always be easier while you're standing there for them
Yeah,
to
that's
print it
true.
than if you have to call back or message them back.
Mm,
So definitely. And as pricing has become a little more competitive, the outside labs are often a lot less expensive. So if
mm.
you have the time and the wherewithal to price shop, it can make a difference.
Right. Yeah. I find when I hear you talking, I'm like, oh, that's something to write in your little notebook. Like ask them to print the lab because it's
That's
easy to, everyone's like walking out the door and you're like, oh, wait. And then if that's one of your top questions, or at least you ask in the beginning, hey, can you
that's
print this out? Good
absolutely.
strategy. So, couple more questions. Can I request the same doctor or hygienist at the dentist? They switched me once. I wasn't happy. I want the hygienist I made the appointment with.
Absolutely.
Yeah, me too.
And the
Yeah.
dentist, that is a very competitive field. There are lots more dentists than there are doctors, so they should want to make you happy. So
Okay.
absolutely request the dentist that you want.
Yeah. This is a great communication skill. Speak up for yourself. Yeah, for sure. Thanks for affirming that, Beth. And the last one I see here, unless I've missed any, I think I've caught them all. How do you know when the next year's schedule is out for the doctor? Oh, yeah. Do you just keep calling every day? Any
So
experience with that? Yeah.
yeah, so they're typically adding a month at a time. So it's not like they suddenly put up 2027. So they like to do, I think at the clinic here in Cleveland, it's usually they're booking 8 to 9 months. Um,
Mm,
I just heard something yesterday. There's a hospital in North Carolina that is booking the end of 2028 for a neurology appointment. Someone
no.
called me and said, should I be pounding the table? I'm like, yes. That is a pound the table moment. That is a get out of wherever you are and go
Hmm.
somewhere else, unfortunately. But yeah, yeah, so
Wow.
you definitely should.
Okay. Wonderful. Okay. Any other questions? Christy, sounds like you got one. Thank you. Oh, how does oh, I want to know this too. Thank you, whoever asked this. How does second opinions usually work with insurance?
That's an it depends question.
Okay.
There are certain diagnoses that they're happy to pay for a second opinion. There are others that you have to kind of navigate a little. This is where if you do have something serious, um, having a care manager at the insurance company can make a tremendous difference because that's your inside advocate
Mhm.
at the insurance company. It's very common that they pay for second opinions, but it's also depending if they think, oh, yeah, your doctor's seen this a million times. You don't need a second opinion. You might have to kind of push and explain why. But yes, it is. They can be paid for, and you want to clear that up before you actually go request one. They might also have a place in network. So you might be thinking of one place, they might have another that they would prefer that they have a deal with. So it's worth asking the question
I
before you
see.
do that. Great
Okay.
question.
Yeah, that is a great question. Thank you. Okay. That could be it. I see some smiles. I don't know. Is that it, everybody? Any other questions that folks have? Um, Well, wonderful. Well, I will be sending a follow-up email. This recording will be available as well if you need to watch it again. I will include Beth's contact information in the follow-up email if you want to reach out to her with any other questions. And I really appreciate all of you being here. Someone just wrote, "This is wonderful. Thank you, and Beth, for this conversation." Thank you. I'm so glad we were able to be here tonight to talk about this because it's on a lot of people's minds.
Yeah, it is unfortunate, but really important. And again, I salute all of you for what you do every day. Just wonderful. Thank you. Thank you, Jenny. Thank you,
Yeah.
Christy. So happy to be here.
Yeah, thank you so much, Beth. That was a lot of fun. Who would have thought talking about healthcare advocacy on a Thursday night? Yeah. So, all right, everybody, this is it. Feel free to I'm going to close the Zoom room in just a minute, but thank you for being here. Feel free to reach out to me if you have any questions about programming, and I'll have Beth's contact information for you tomorrow. Take care and good night.
Good night, everybody.
All right,
Thank
take
you.
care. Bye bye.